topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Houston. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. We have got an incredible, both our shows say are really incredible, but the first show is very near to my heart because I'm one of those people who suffers from sleep apnea. And we have an expert who's now been with us for several years. We normally talk about dentistry, dental implants, but today, because Dr. John Van Slate also deals in sleep apnea. Good afternoon, John.
Hey, Steve-O, how are you doing? Good afternoon as well.
God, I was telling John before the show, we get so many texts and emails from you, the listeners and viewers, about how much you enjoy this show. And John, I think they love your heart and your knowledge, but mostly the way you explain to everybody.
Sure. Yeah, well, I enjoy it, that's for sure.
Yes. So, and we already got our first question already from text, but John, tell us first of all about your practice.
Well, I'm a general dentist, and I practice in kind of in the West Galleria area of Houston. I've been here for over 30 years in the building that I'm in right now, and just enjoy what I'm doing. But I'm a general dentist, and I do a lot of TMJ and sleep and high-end cosmetics and things like that. So just enjoy what I'm doing.
Hey, John, it's really weird is I guess you refer to yourself as a general dentist. Is that right?
Yes.
But you know what? With all the stuff that you do, John, and all the new technology you have in your office, it seems like you're just more than just a general dentist.
Yeah, you know what? I mean, that's the great thing about being a general dentist is you can wear a lot of hats. I mean, I do what I do, and I'm constantly learning, as you know, Steve-O. That's one of the things I love is you learn and then you keep compounding on what you've known before. And but I just like doing a lot of things in dentistry. I couldn't imagine having to just specialize in one little thing because I like doing it all. I like doing too many things.
And John, you don't just sit back and say, hey, I put thousands of dollars into something and I'm just going to sit back and use it. You're always looking for something new.
You have to be. I mean, that is our profession. I mean, dentistry is one of those things that you can reinvent yourself many times, just learning and learning how to do something better or learning a different field of that we're in. But it's a constant learning experience. And that's also one of the things that I've enjoyed about dentistry.
What made you get into sleep apnea?
Well, I kind of fell into this because I started treating a lot of TMJ, as you know, in my practice.
Right.
And we started building a really big TMJ practice to help people with a lot of their pain. And really what happens, Steve, is sleep apnea goes so hand in hand with TMJ. It's one of those things where what comes first, the chicken or the egg? Is it sleep apnea that causes TMJ or TMJ that causes sleep apnea? It really is a combined feature that I kind of just fell into as a result of doing so much TMJ work.
Well, I got to tell you, this is why I'm so excited about today's show. I have sleep apnea, and I know I got it because I had high blood pressure.
Sure, that's one of the symptoms.
I let it go, which I'm telling people now. I don't know if it starts off with snoring, but I got to tell you, the CPAP way, John, I know
Yeah.
you've got a better way to do this, but
Yeah.
first explain to everybody what sleep apnea is.
Well, sleep apnea, Steve, as you know, it's a sleep breathing disorder where somebody just starts and stops breathing many times in the night. And the interesting part about that is that it's usually going to make a gasping or choking noise, and it's usually witnessed by somebody else. Usually, the person who has it doesn't even realize that they have it. But the real serious part about sleep apnea is if you're stopping breathing, you're just not getting oxygen in your blood that goes to all of your organs. And I will tell you, you cannot be in optimal health if you have uncontrolled sleep apnea. It affects everything in your body, and it's serious. And it's one of those things where we call it obstructive sleep apnea because something is not allowing air to get you. You can't get an air. Something in your throat is causing that obstruction. It can be tonsils. It can be a large tongue. It can be carrying weight in your throat. But the bottom line is, you don't want to have an untreated sleep apnea. And if you want to get in kind of a layman's terms, what really technically it is, an apnea episode is defined as somebody that doesn't breathe for 10 seconds. Did you know that, Steve?
Yeah, I know. That's why it's so
That's
dangerous.
what
You actually stop breathing.
You stop breathing. And converse, a hypopnea is if you stop breathing for less than 10 seconds. But there's a number that we use in the sleep world called AHI. It's apnea hypopnea index. And on a sleep study, if somebody has 5 to 15 of those at an hour, then you'd be a mild apnea patient. If it's 15 to 30, you'd be a moderate. And then if it's over 30, you basically have severe apnea. And the bottom line is no matter where you are in that, you really need to get it treated because it can be a pretty insidious chronic disease.
Well, I got to tell you, we get, and this text we just got in reminds me, there's a lot of people that, John, snore. I know you know this, that snore, but don't think they snore.
Sure. Oh,
and
absolutely.
A family member will say, "Hey, stop snoring." And they'll go, "I'm not snoring."
Yeah. Oh my gosh. I have it all the time in my practice. I have a wife that'll come in and I'll be asking her, "Do you snore at night?" And she'll say, "No, but my husband's like a freight train."
Yes.
I have treated people with sleep apnea and they're just loving me because for the first time they're sleeping in the same room again. That's a real deal, that the person who has it or snores doesn't know that they're doing it.
They're
It's
like
crazy.
in denial.
Yeah. It's just crazy.
You know what? I want people to know by this, not to be embarrassed by this.
No.
I know when someone would tell me I snored, I'd be so embarrassed. And of course, I deny it because I didn't hear myself. But it is so important. This is what we're going to do today. Our show is you've got to get it treated.
Yes.
And,
Yes.
and
It's not embarrassing. In my practice, it's not an embarrassing thing. It's something it's something you just need to be treated with. And so that's it. There's ways we can fix that.
Well, the text that came in says, a friend of mine just called me up to tell me I need to listen to today's show and tells me I snore. I don't think I do, but I'm going to listen to the show. And that's what made me think of that.
Absolutely. I'm glad they're listening.
So is there any way to know if a person has sleep apnea?
Like symptoms wise? Well, if the typical symptoms that I see, just like we talked about snoring, that's usually witnessed by somebody else. Now, here's what's interesting. You don't have to be a snorer to have sleep apnea. You can have sleep apnea when not being a snorer. We'll talk about that probably.
I didn't know that.
Think, you don't have to be a snorer. But I would say that the main symptoms that I look for typically is when I look in the mouth, does somebody carry a lot of excess weight right here in the throat? Because really what apnea is, when your throat relaxes and closes off the airway, it's because they have a lot of weight back in the throat. That can be also enlarged tongue, enlarged tonsils, and adenoids are also a big deal. But probably for a person, the thing that people will recognize the most is we call it EDS, or excessive daytime sleepiness. These people are usually going to be nap takers. They'll fall asleep at the drop of a hat. They'll sleep in things that you wouldn't think of, that like in loud places they can sleep, in driving a car, God forbid, but some people have done that, they'll sleep driving a car. But these people, remember, your brain sends a signal to you to start breathing, right? So a lot of times these people, they're constantly having to. Their brain is constantly telling them to start sleeping or stop snoring. So as a result, they just never get a restful sleep. And these people are tired all the time. And I'll tell you,
Yes.
irritability, trouble focusing, this is real. These people have that. They're usually going to have more stress and anxiety. A lot of people, ADD is often nothing more than a breathing disorder or sleep disorder that is, especially with kids, you'll be put on ADD medication, but these kids aren't sleeping. And it's really sad to see those kind of things. It's usually just a sleep breathing disorder that causes a lot of that. But one that goes ignored, Steve-O, and you being a person with apnea, is allergies. And I mean, do you suffer from any allergies or sinus issues?
I don't, but I have. Listen, John, the reason why I went for a sleep test is I was falling asleep at the wheel.
Sure.
And it was like, I mean, I could have killed myself or killed somebody.
Yeah.
Because all of a sudden you just start dozing and I couldn't understand. Yeah. That was my main problem.
Well, that is the excessive daytime sleepiness. I mean, if you're doing it at driving, that's pretty wild.
Yeah.
But when I told you that, you don't have to snore to sometimes have apnea, well, that's where allergies will come in and not being able to breathe through your nose. What'll happen is with allergies, if somebody has an inflamed turbinates in their nose or a deviated septum or sinus issues, if they can't breathe through their nose, then they become mouth breathers. They'll breathe through their mouth instead of their nose. We should all breathe very comfortably with a lip seal, tongue in the roof of the mouth, and you should be able to breathe through your nose that way. And if you can't, I can tell you what we do a lot, Steve, is we'll take tape and we'll actually tape somebody's lips and have them sleep with tape. And it's diagnostic because you should be able to sleep with your mouth closed. If you can't, most likely you might have a sinus issue that you need to see an ear, nose, and throat person about to get rectified before you can ever think about helping a sleep apnea patient.
John, you also treat thrush, right?
Treat what now?
Thrust.
Oh yeah. You're talking about like thrush, like gum infections?
Yes. Does that have anything to do with sleep apnea?
Well, I will tell you this. It's interesting that you say that because if you breathe through your mouth a lot, right, then you get dry mouth, which is really tough on your gums. And so one of the things that causes thrush to the gums is dry mouth and dry. So yes, you do see that a lot with this. That's interesting that you knew that, Steve.
Listen, I've been through this. What are some of the things that a person can do to prevent sleep apnea issues?
Well, what I would say first and foremost, losing weight is always the go-to. I've literally seen people lose a significant amount of weight and stop their obstructive sleep apnea altogether. Exercise, not so much for the health benefit, but more so it creates a sleep rhythm. So exercising frequently, staying away from really sugary foods, those refined foods, because it's an anti-inflammatory. And then vitamin C and vitamin E are great anti-inflammatory things that you could use. But sleeping on your back is a big one. Sleeping on your back, what happens when you lay back? Gravity just forces your mandible back and closes your airway. So a lot of times what we try to do is, if people do sleep on their back, we tell them, don't sleep on your back, do it on your stomach or your side if possible. And I'll have them put a wedge pillow in or even put sew tennis balls in a t-shirt on the back so that you won't roll over on your back. But it's one of those things where, just a positional change can sometimes help with sleep apnea. And one thing that's pretty serious that people got to know about sleep apnea, remember that sleep apnea, when you don't breathe, your brain signals signal to wake up, right? If you are somebody who drinks alcohol before you go to bed or takes sedatives before you go to bed, that is decreasing your brain's ability to wake you up. So, when you talk about people that are dying in your sleep, those kind of things, this is what is happening. A lot of these people have probably had alcohol before they go to bed and a severe apnea, and things like that will happen. But, apnea is one of those things that you just got to realize that it can literally take 12 to 15 years off of an average lifetime. So it is serious, and you want to get it treated if you suspect you have it.
So what if your mouth opens at night and causes you to snore? is it the sleep apnea is making your mouth open at night when you sleep?
Well, usually it's just very simple, Steve. You're doing everything you can to get oxygen, right? You are trying to do everything you can to get oxygen. And so the less you're able to breathe properly because there's an obstruction, the more you're going to do everything. A person is going to sleep usually with their mouth open. They're going to try to get in as much of that oxygen as they possibly can. And that's very, very common with sleep apnea patients.
So what are some of the things that can happen to a person who, I'm sorry. Well, of all times. Rebel, you're going to have to catch me if that goes off again, because I'm going to put it on mute if it does. I'm here in at the office. For some reason, we've been getting fake fire alarms going off.
Oh, great.
Can people snore while they're awake?
Well, that's an interesting question. That is one that I don't think I've ever been asked before, Steve. I mean, snoring basically, typically, people can breathe. And if they have a breathing issue, then yeah. I mean, if you're reverberating in the back, I go, you don't necessarily have to be asleep, but typically, yeah, snoring is a sleeping thing. But, with you saying that, you hear people sometimes when they're awake and they seem to be more nasally sounding and
yes.
Yeah. So sure, you can still make a noise while you're breathing and be perfectly awake.
So tell people how you treat do they have to go get a sleep test first, John?
Well, I'm so glad you mentioned that. You always have to start with a sleep test. Now, This is what I'll tell you. Sleep test, we call it a PSG. It's a polysomnogram. And this is something that typically a person will go to a sleep center and they say they're overnight. And man, we can just find out all sorts of things on a sleep test when they do that. But what I'm loving right now in the sleep world is now we have sleep screeners that you can do at home that can be sent in the comfort of your home. Now, they're screeners. So what I use it for is I might send somebody home with one and they'll use it for a couple of nights. And then I send the data to a sleep physician. Board certified sleep physician has to read it. But once they do, then if somebody comes back and I can say, how much he's snoring, I can see how much apnea issues they may have, the blood oxygen, pulse and blood pressure. We can find out all that information. If they're a severe apnea patient, then I still send them to a sleep physician to get a formal sleep study. But if they're mild to moderate, then I can treat them all day long with my dental appliances and things like that. Okay. But in general, if you have a severe apnea, which I'm assuming you do since you're having a CPAP, Steve, that is the gold standard. A CPAP, continuous positive air pressure. It literally gives you air. It pumps air into you. And people, when they start on a CPAP machine, their life will change. I mean, they sleep better. They feel better. They're more rested. Did you have that experience? I mean, you feel better once you started?
It's still, I use the nasal.
Yes.
John, it's no way to sleep, but it does stop you from snoring.
Yeah.
And you do feel more rested, but having that mask on you all night long.
Well, it's cumbersome.
Yeah.
But look, I mean, that's where I come in. I'm as a dentist, I mean, we make sleep appliances for people. That's what we do. We make appliances. And so we make an appliance, and here I can show you what one looks like. I've got it right here. But this is I use the Evo ProSomnus appliance, and I love this appliance because they're not connected. They're two pieces that fit together. Okay. And I love these appliances that we're using now because remember, this is a chronic problem. You don't want to use something that's going to be easily break down or wear. So you need something durable, you need something strong, and you need something comfortable. And you see the over-the-counter ones all the time, the cheap ones, and
they don't work.
They don't work.
They do not work.
And they can cause jaw problems. They can cause strain on your jaw joints. They're connected. I mean, there's a lot about those things that are just cumbersome. Now, they're inexpensive, which is the big key, for people wanting to do that.
How about the tape over the nose, John?
Yeah, there you go. Breathe right. I mean, anything that it's, whatever it takes. But the whole thing is, I love the appliances because these things are milled out of a hard acrylic. They're extremely durable. I mean, you can wear these things for literally years. And I have been doing this for a long time. This by far is the best appliance that I've seen. Wow. And I've been through several generations of these appliances, but I love this one. They're just really great on the muscles. You don't wake up with a lot of tenderness in your jaws. Your jaw joint is not affected because we tend people to find a balanced bite while we're taking the bite for these. And it just really is an effective way and a long-term way to really help. Certainly, I mean, we can stop snoring by over 90% with these appliances. And with the apnea, it is amazing the improvement we get with apnea. And so
they have to be fitted.
Well, yes. What I do is I use a digital scanner. Remember the one we showed you last time? We use that digital. It's like a video camera that I take of the teeth. I send that to a lab to have it designed by. It's all milled on a computer now. So a computer designs it, mills it, finishes it, and then I get it. And the beauty of that, when you do it with a digital scanner and have it milled, these things are unbelievably perfect fitting and comfortable. So you don't have a lot of those issues that we used to have with impressions and things like that.
That looks so much better than the CPAP machine, John.
Yeah. Well, listen, this is where people with mild to moderate problems, or they're CPAP intolerant, they don't like a CPAP. This is, I make a ton of these for CPAP people. And I even have CPAP patients that use this also with their CPAP, but it's great for going out of town because this is all you have to bring. You don't have to bring the machine and everything like that. Right. It really helps with those kind of things. So there's a lot of neat reasons to get these appliances. And I mean, we do them all the time. We've had a lot of success with them, and I'm a true believer in them.
John, how come there's no cure for sleep apnea?
Well, that's a great question. It is a chronic problem, and there really isn't a true cure. You can really eliminate the symptoms. And, lip taping is a big one. Mm-hmm. If you can train yourself. Now, again, lip taping to break a habit, 6 to 9 months maybe. But I'm talking about you use that lip tape every night. If you can train yourself to breathe through your nose, that's a significant step in stopping sleep apnea. That's one. Number two, weight. If you can lose weight to try to get as much off of your throat, that's another big way. But I have seen people eliminate sleep apnea doing just those things.
Now, I'm going to tell you, mine's not a CPAP machine. Mine's a BiPAP machine.
So that's for people that have airway, like COPD or pulmonary issues.
They're no fun to wear. And when I use the CPAP, I'm going to tell people, I got to tell you something. If you have sleep apnea and you're using a CPAP machine, what John is showing you, I got to tell you, is so much better. And John, tell people again, by not taking care of the problem, what can happen?
Well, this is what I think the main takeaway here is, that you're not getting oxygen. That means it's not getting in your bloodstream, and all the vital organs that you have are going to be adversely affected by that, especially the heart. More cardiac disease, more cardiomyopathy, more congestive heart failure, heart attack, strokes. These are all exacerbated by a sleep apnea problem. Just really, if you have any kind of an internal organ issue and it's not getting oxygen, it's going to be worse. Diabetes 2 is a significant thing, because if you don't have enough blood oxygen, it'll affect your blood metabolism and insulin resistance. So we see a lot of people with diabetes 2 have sleep apnea, and you got to treat all these kind of things to really help. So it's a significant issue, Steve.
So if they come in, first they do go do the sleep test. How many times they need to come in to be fitted?
Well, it's very simple. You get the sleep test done. We determine, are you a candidate for a sleep appliance? We scan in one day. You come back a couple weeks later. We place the appliance, and usually I have people come in to see me a couple times after, just to make sure things are comfortable. But it's a simple process. When we make these appliances, you're going to get 5. You're going to get 2 upper appliances and 3 lower ones, so that it's called titration. If they have to move forward a little bit to open the airway more, you have the ability to do that also with these appliances.
Wow.
So that's something that somebody might want to come and see me a little more often on.
John, I knew this would happen. The show went by so
flies
fast.
by every time.
It does. But John, the good thing is John's going to be with us again next month. John, tell people how they can make an appointment to see you.
Well, it's real simple. You can call us here in Houston at 281-886-3164. And we're more than happy to see anybody who wants to see us.
For any of your dental problems, John is the best. John, I'm so glad you were on today. We'll see you next month.
All right, Steve. Have a great evening. Okay. Good talking to you. All right. Bye-bye.
That's Dr. John Van Slate. He's amazing dentist in the Houston area. We're going to go to a quick break. And when we come back, we got another one of our health shows. One of the top doctors in the city of the Dallas-Fort Worth area. I'm going to include that entire area. She's just that good. We'll be right back.
And we are back with the Ask the Expert show on W4CY Radio and Talk4 TV with your hosts, Steve-O, Sophia, and their expert guests.
And we are back. Rebels, Dr. Gamboa on yet?
Nope, she probably is still with a patient.
Okay. Well, you know what? I'm going to send our great producer over some. By the way, we've been doing this for well over a year. Is that right?
With Dr. Gamboa?
No, you and I.
Oh, yeah. Definitely.
You know, I finally saw what you look like.
How'd you do that?
What do you think?
The Adventures of Pipe Man.
Yes.
Which day did you watch?
Rebel.
Did you watch it today?
What's that?
Did you watch it today?
Yes, I did.
Uh-huh.
And Juan was on there?
Yes. Yeah,
You did
we are
good.
Pipe Nuts. Thank you. Dr. Gamboa is with us.
Okay. If you can put her information up. Elite Care. Oh, there she is.
Hey, how are you? I think they put it a different information. It said something else.
Hi, Dr. Gamboa. Now,
Hey, how are you?
I can't believe you've got this big monthly show and you put a patient before the show. How could you do that?
Because I have to see patients until a little bit before the show. So that's what I do.
Dr. Gamboa, I was amazed. And I don't know, do you still teach?
I do, but I only go now once a month. I'm a part-time faculty at UT Southwestern, so I go there to be with the residents, supervise them in the clinic, seeing patients. So that's what I do, half a morning once a month.
What kind of health issues do you see at the hospital?
Well, I don't round in the hospital now. I used to, but now we only see it as an outpatient clinic, and it's the same, COPD, diabetes, weight gain, and then high blood pressure, cholesterol. So all the normal things that we see.
It's amazing. A lot of these things have to do with weight, don't they?
Yep, exactly. So that's what happens.
You know what? I'm learning more and more since we started doing the show, and the letters that we get. People have tried so many things to lose weight, and there's not really a lot of things. There's not a magic pill.
I wish there was, right?
Yeah.
There's nothing magical, honestly. We just have tools to help our patients,
So what I'm saying is when they come to you about a weight problem, they've tried a lot of things, haven't they?
Oh, yeah. You can name it because, this has been going on for years and years. And this has also been an industry, unfortunately, all these other companies, Weight Watchers. Then there was this Herbalife. Then there was this other fat diets that they are always in the internet. Oh, if you only drink orange juice for a week, then you're going to lose weight. I mean, things like that, or silly things that they were called the fat diets, there was all the time like that, or cleanse diets or like only water for like, I don't know, 24 hours, things like that, that you're like, if you think about it, it's like they don't make sense. And then a lot of the times they just dehydrate you, and that's how you lose weight. But in reality, you're not really like losing weight. It's just like water. So
You know what, Dr. Gamble? I think a lot of people try to do this on their own. And I think I know now, you have got to have a doctor because there's so many things that you can do. There's not one pill that's going to cure everybody. And, we've talked about the injections, which I think are amazing,
yeah.
amazing. But, it's not just about diet. It's not just about working out. It's not just about supplements. There's so many things. And, it could be a hormone problem, could it?
Oh yeah, like there's so many things, and that's great that you bring this things that it's not only one thing, like again, like as a patient, we always have to help you, and we always see it as a whole, like it's always we have to check your hormones, your thyroid. The thyroid is the director of the orchestra. We have to see like if you're having insulin resistance, like all these things that they are causing you to gain weight. And the other thing also that is something very, very important that I want you people to know this, it's about your microbiome. How important are your bacteria in your gut? So this is like a second brain that we have, and we have to make sure that this is always with good bacteria. So always take a good probiotic. If you're taking lactobacillus, if you're taking culturelle, align, or any of those, that's excellent, but always rotate them. We always need diversity because we have like a trillion bacteria in our gut, and we always need diversity. We always need different ones because nowadays more and more research is showing that different bacteria help with different things. The one of them, they help to like digest food. Then the other ones help to like in the immune system. The other ones are going to help you like with other stuff, but we definitely need like more diversity. And nowadays, with our food, our processed food, the chemicals, the antibiotics, that we love antibiotics. I mean, you go to an urgent care and all the time you get antibiotic. So they distort this, and then we become and have the leaky gut. Probably you've heard that term. And now we can say for sure with electronic microscopy that yes, it exists, and that's causing a lot of problems. 90% of our serotonin, the hormone that it's the happy hormone, the anxiety, the calming hormone, is made in our gut. So if we don't have a good health in our gut, then everything else is going to like cause or affect all the other things. And nowadays research is looking at the kind of like the origin of a lot of chronic diseases, and they're looking at the possibility of being in the gut.
We've gotten a lot of letters this week. We had a lady who wanted to know, do you treat osteoporosis?
I don't do the osteoporosis. I definitely help you because I do hormone replacement, and hormone replacement is one of the best things to help you with your bones. There's nothing else better. But I don't do the infusions like usually they do. Like those are done by the rheumatologist. There's another place in UT Southwestern that is the Metabolic Bone Clinic. So they do all that. But I do the hormone replacement, which is one of the best things for the bones. Of course, like if you eat your foods that they have calcium, or you take your calcium supplements, your magnesium, your vitamin D3 and K2. So all of that are going to give the strength to your bones. And of course, if you also do some weight bearing exercises, that's also going to help you with your bones.
But it can be treated though.
Oh yes, it can be treated. Like in fact, some infusions are they have some good results. The only thing is the downside of some of these medications that are for osteoporosis. They can also have other problems. For example, these medications basically they tell your bones not to kind of like over clean your bone. So like whenever we have a bone, so like one mechanism like takes out the old bone and the other one restores what it took. But if the mechanism of like taking out the old bone is too much, then that's a problem. That's an imbalance. So these medications, they kind of like slow down that mechanism. So whenever you're having your teeth pulled or some problems or some like dentist surgeries, then you can have problems because that mechanism of restoring or like renewing the bone, it's been a little bit slowed down, and sometimes you can have what they call it necrosis, or that tissue dies. So we have to be very careful with this, so I would say, like, this is an analogy that we use. It's like if you have a street with potholes, then you're patching the potholes, and that would be like whenever you take those medications. But whenever you want to really like do a better job, you strip all that old asphalt and then you put a new layer on. So that's what the hormones tend to do to your bones. They kind of help you way better.
I'm going to bring up a touchy subject, but we know so much more about it now. Are you still getting patients with COVID?
Yes, I'm having a lot of them, and the good thing, what I'm seeing is that now they're not having as severe symptoms as they did before. So what I'm seeing now is like more sore throat, like depending on the patient or the comorbidity, sometimes they can have fever, they can have chills. And not long ago, my father-in-law, like who has a chronic disease, he only had a scratchy throat. He just like had like the sore throat, a little bit of like headache, and that was it. And I'm like, I'm sure it's COVID. And yes, it was, because all of my patients are coming with similar symptoms. But thank God this time they're not attacking to the lungs. It's not causing like a difficulty breathing. Of course, if you have COPD or asthma, we have to be a little bit more careful with you. But other than that, I'm not seeing as worsening symptoms as before.
I went into an emergency care because I had a cold for 3 or 4 days and vitamin C wasn't knocking it out. And they said, well, we're going to do a COVID test on you. And I said, I don't have COVID. I have a cold. They said, we have to test anyway. And I
Was
had
it possible? Yes,
it was
that's
positive.
what happens. So
And
yes.
I didn't even know it.
Yes. So that's what happened. It's more like a cold, as you called it. So it's like that. So we have to differentiate if it was and like it's only like depending on how many comorbidities you have, how old you are. Because if you're like a younger person, like we don't have to give you any medication, just supportive treatment. Like vitamin C, D, zinc, good hydration. If you have body aches or fever, just Tylenol or ibuprofen if you can take them. But if you have like COPD, asthma, then we have to see like what we need to do to help you, like depending on also like if you got your vaccines, like how you're doing. So many factors that can like play in this making the decision whether we have to give you medication or not.
We got a letter from a viewer. First of all, she said how much she loves your show and she never misses it. And she's so glad it's always the last Wednesday of the month so she can keep up with it. But she's 69 years old. And she said, I've even done the injections. Nothing works for her. And she's wondering if it's a hormonal problem. Could that be why? And she's always tired, she said.
It's very likely, because like we also have to check her thyroid, but just have your thyroid checked, not just the traditional TSH, that's the hormone that it's like the screening one, that it's the stimulating hormone, but also you need to look for the functional part of your thyroid, like the free T3, for example. That's the biologically active part of the thyroid, and that's the one that is going to activate the receptors. So that's the one that is going to determine if you lose weight, if you're constipated, if your hair falls off or not, so your metabolic rate. So you have to get that checked. The other thing that also plays a big role is your hormones. Yes, that's
Is
blood
that
work. So
okay?
everything would be blood work, like also like the hormone, like the testosterone for sure. Like that plays a big role too, because yes, women also need testosterone. So even though like our amount of testosterone is basically like 10% of what the guys need, but we also need it. And the testosterone is great because also helps with decreasing the visceral fat. It helps with the lean muscle, and that also helps again with the prevention of the osteoporosis. It gives you energy. So also we have to see how you're sleeping, because like whenever your testosterone levels are low, then you are waking up several times a night. You're not sleeping well. You're not resting. Or if you snore, we have to think about, are you having a sleep apnea? So that's why you're tired in the morning. So there are so many things that we have to look into. How is your iron? Are you anemic? So again, many different things that we can do, because it's not just injections and then good luck to you, like I'm going to hope you lose weight, but we have to look everything else and everything around it. It's like an engine. So you cannot just expect put gas in an engine and then just expect it
Right.
to work. We need the oil, we need to check the valves, we need to check so many things to make a motor work perfectly. And it's the same thing with our body, like, so always check for everything else, not just like injections and then hope for the best.
Well, let's talk about injections. I'm on the injection.
Mm-hmm.
I tell you what's scaring me
What?
um, is I am getting so many ads from clinics around the country who are
Yeah.
like giving these injections out like candy.
Yeah,
And
like,
I'm really afraid because I really think you need to be under a doctor's care in order for these injections.
yes, you have to be careful. I was reading an article about the counterfeits that now they're having from China, from Brazil, for the Ozempic, and I'm sure they're like going to not take too long to make the other ones, like the newer ones, like Zepbound or Monjaro. But for sure, Ozempic is having counterfeits that is very difficult to notice the difference. You can tell only by the lot number that doesn't make any sense or doesn't match anything. So you have to be very careful if someone is too good to be true, or someone is giving you like very like a low price, then probably something off in there.
Yes.
Also, like the what you were saying about this other clinic. So not long ago, I was at the mall, and there's an IV bar in there, and they were offering semaglutide. So we also have to be careful about the compounded. Yes,
Yes.
like it has to be like I know like it's not FDA approved, and many other people do not. The societies do not recommend about this, but like there's some like doctors and clinics that they use it. And then you just have to be careful about where you are sourcing it, because yes, this pharmacies, if they are FDA regulated, they are 503Bs or 503As, then they are getting their compounding materials from FDA regulated places. So those are the ones that most likely are going to be legit, because remember, a compounding pharmacy is here to help. Whenever there is a shortage, national shortage of a
Oh,
medication, then the compounding pharmacies are here to help that avoid, like help that shortage, because like patients need this. And with these medications, we've seen that so many patients, they work. So that's why so many patients want it. But we have to make sure that we are having a good quality product. They have a good sterility method. They have like a good third party randomized like auditing that are checking for sterility, they're checking for dosing, they're checking for the amount of medication and the purity of the medication that we're giving you.
I get mine from CVS, and I'm hoping that
Yours is the legit one. Like this ones are that's not compounded.
well,
Yeah,
we have what I'm noticing is a lot of these places are wellness clinics
yeah,
that are, they'll send it to anybody, any part of the country. And
yeah. So
I'm a
those are the
little
things that those
concerned
are
with that.
yeah.
Um,
You have to be
but
careful.
yes, and I'm really kind of surprised that that's happening. But I want to say this: I got to, I'm on Ozempic.
Hmm.
I've lost 35 pounds.
great for you, Steve.
I got to tell you, though, so I've had severe kidney problems. That's how what my doctor, nephrologist, is the one that turned me on. I got to tell you, since I've started taking this, my entire blood work is so much better, Dr. Gamboa.
Exactly. Yep.
And I don't have the swelling in my feet anymore. I know it's from this.
Yeah, it is. You better believe it.
There's so many positive things about this.
And now, like the studies are showing that they decrease the risk for stroke. They decrease the risk for like cardiovascular disease. So and now they're looking into like decreasing the risk for or improving the chronic kidney disease. So they're still doing this good things, like the version for weight loss for Wegovy, like at least Medicare now like approves it only for patients that already had an event. But at least there's it's a step forward, like I think last time I also said, okay, if you survive an MI, a heart attack, then we will cover it, Yep. But and that's the only way they do it. But at least it's a step forward, and we're like, okay, finally we're getting there. Hopefully it's going to be better and better, that they're going to demonstrate that these are so beneficial for the health. I have patients that they were in 3 different blood pressure medications. Now they don't take nothing. Their blood pressure is normal only with the weight loss. Then patients that used to be in very high doses of insulin, the diabetics, because we were maxed out with everything. And I started on this injections, and now they use 0 insulin. They only use, and then the kidney function has improved. So it's very, very good, and they are so beneficial. And I wish all the insurance companies and the government and everyone sees this way, that this is the way to move forward. This is the way to prevent chronic diseases, along with, again,
save them money in the long run.
Exactly. That's what we see it. But unfortunately, insurances don't see it that way, because they only see it the short term, because they're like Steve is going to drop us, next year he's going to go to a different insurance company. So why invest in him? So maybe the next thing to do will be to fix that, maybe Geico, Progressive, and everything. So we have all that for the health insurance, and we can use it and we can choose it. And it's for us whenever we can, not only depending on our job, because that is the problem.
I just want to tell you, we have a wellness doctor in Atlanta who does the weight loss in our Atlanta show. And I told him what you use on your patients. And he said that he's really likes that injection.
Yeah. So those work really, really good, and the technology gets better. Everything gets better, so these injections are getting better. So the newer injection, Zepbound, is a little bit more advanced than the previous one. It has 2 peptides instead of 1, so 2 do a better job than 1. So they're going to continue to get better. I think in the line of it's coming at 3 peptide one. So excuse me. So that's what it's coming. So it's coming really good things for weight loss, obesity, and I think to help patients.
Dr. Gamboa, tell people how they can set up an appointment with you.
They can set up an appointment with me by calling 469-947-6020. Please be patient, because now my new patient appointment is a little bit further, but we're trying to accommodate everyone.
Stop being such a great doctor.
I am being blessed, Steve. Thank you so much.
We are so lucky to have you. Thanks again. Tell Harold hello for us, and we'll see you next month.
I will see you next month. Happy Labor Day for everyone.
Thanks. You too, Dr. Gamboa.
Bye.
That's Dr. Gamboa. She's wonderful, and she's with us the last Wednesday of every month at 4:25 Central Time. That's it for us today. We'll see you again next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.